So there are some deaths that can be careless deaths. If you look at the head of this baby, and the head of the baby is too much, they might advise you for a Osumba. She is trying to prove to another woman na audio. This woman that did this thing was busy eating apple and other thing, was doing other thing. You were busy eating indomie and eating all this nonsense. And by the time it time to deliver, the baby is already too big. And you cannot deliver. You were told December. Ishinwa the too big. December. To prove to one in need you. Then eventually the baby might come out from that place and disfigure everywhere. All those places they will be called in Ambo. Now, even if we want to correct that vaginal pathway that has been destroyed, you will still pay more than they get MSCS. So why going through all this? Who are you trying to impress? I was telling people, anything, anybody for my wife in labor room, or not possible. I will always tell her to bring her car. To be one hospital. But if you do it when everybody is strong, that is the point. But if the head of the baby is okay, if everything is ideal, there are women that will be shouting, "Doctor, meme operation, Esiamba." Because at that time, you know she is not talking from experience. It is her pain that is talking. There are people that will be in the theater, they will be telling meme operation. It's not a because who naturally want to the cause. Because the Bible is not through the pain shall you bring forth the baby. If you look at that person, you look at the head is okay, everything is okay, the pelvis is okay, everything is fine. Whenever they say you augment, the baby will come out. Fine. Provided that the heartbeat is okay, everything is okay. But if you look at it and there are chances that the baby might not make it, or that the baby will make it with undue injury. I don't know if you understand. Yet the Bible says that from pain shall you bring forth baby. I don't know if you understand. But the Bible also says when you hear the cry of the mother, you will hear the cry of the child. So if the child now cries, if the woman now cries more than the cry of the child, now once you hear the cry of the mother, you should hear the cry of the child. And after you hear the cry of the child, what next will happen? You now hear the smile of the mother. So the sequence is like this: cry of the mother, cry of the baby, and what? Joy of the mother, or the smile of the mother. So if there is cry of the mother, then the cry of the baby, then there is continuous cry of the mother. This is a misnomer. I don't know if you understand. You look at anything that can cause it, you stop it along the line. That's basically that. But usually, even if there was no birth trauma before, whenever a woman takes in, estrogen level is increased. There is widening of the pelvic. Those joints will start increase. Sometimes they change the way they walk and a lot of other things. And once that happens, even for a normal person who doesn't have a birth injury, I don't know if you understand, they will have the womb starts dilating. But usually it doesn't occur in 1 month. But it might start earlier. Might be a coincidence that this womb wants to start working now. I don't even understand. But the major thing to do is not to start treating it. It's to prevent it from occurring in the first place. And usually we request for 36 weeks ultrasound and beyond, gamma the weight of the baby, and also the head circumference.